Okay, I am not editing this video. I am just making this very quickly because I've been asked about what I'm seeing in the market selling Medicare products. And I've been asked by a couple of my clients. And what I want to go over is just to show you something real quickly here on the plan finder that may be interesting to people who are working at health plans. And so I'm going to share my screen. And so what I did was I put in two drugs. I just put in Eliquis and Manjaro. And because this was an example I had earlier this week when I was working at a facility just trying to help some of their members get their medications. Now, this particular facility I was at is a disproportionate share hospital that has 340B pricing and all this kind of stuff. And so several of the members were actually getting the medications through the 340B program and not necessarily through their insurance plan. And so what I want you to see is as a health plan, next year you may see more of those claims come to you versus them going through the cash program at the 340B because it's actually going to help the member on their Part D side if they can get that medication. So this particular example, they were getting the Ozempic through like a patient assistance program actually not through the patient assistance program, Trulicity, I think they were getting through like the 340B program. Eliquis was the same way. They were getting it through the 340B pricing versus going through the insurance. So what you can see here is for next year, if I put this Manjaro and this Eliquis in here, and this is for a Medicare Advantage plan, and I do done adding drugs, I just chose CVS because that's the easiest one to choose, and then I click done. And so once you go in here, the plan finder, remember, is going to do it by lowest drug and premium cost. And so the very first plan that comes up is United Healthcare. And for the whole year, this member will pay $631 for Manjaro and Eliquis. Now, remember, next year, the max out of pocket is $2,000 due to the Inflation Reduction Act. When we go in here and do plan details, and we go down, we see we have a drug deductible of $255. We go to drug coverage. What we're actually going to see is this is the yearly drug cost by pharmacy. They'll pay $443 for Eliquis, $188 for Manjaro, and the total is $631 for the year. Also note this right here, we're going to come back to it. It's the Medicare Prescription Payment Plan. CMS did a great job, in my opinion, on explaining this with this calculator, but we'll come back to that. So it says total drug and premium $631. You'll meet your deductible January 2025. And then here's what you'll pay each month if you fill Manjaro and Eliquis each month. And so what happens is when they get to May, they're not paying anything because they have met the $2,000 out of pocket, although they didn't necessarily pay it out of their pocket. That's because of how the calculations are made between a defined standard plan and an enhanced alternative plan. And so when we keep scrolling down, we go here, we see for this United plan, the copay is $47. And so the defined standard plan would have had that cost share at 25%. So therefore, the difference in the price, so Eliquis is $586.91. 25% of that minus what the $47 copay is going to go towards that $2,000 max out of pocket. Manjaro at $1,055.17, 25% of that minus the $47 goes towards that member's $2,000 out of pocket. So therefore, what you're going to see is the member is not necessarily going to pay $2,000, but they're going to get counted credit for what the plan is paying on their behalf in this enhanced alternative plan. Same holds true for the deductible. That is $255. And the defined standard deductible for 2025 is $590. So the difference between the $590 and the $255 also is going to go towards the member's $2,000 out of pocket. Okay, so this person's making out very well next year when it comes to what their cost is going to be. Now, from a health plan perspective, what you may be able to see, you may not have saw that person on Ozempic this year because they've been getting under a patient assistance program. They've been getting it under a 340B program. So you haven't seen those claims. However, now with the right information put into the plan finder, what they can see is that those claims now can be put onto the Part D plan, and you as a health plan are now going to be picking up costs not only from drugs that you already knew that they were on, but for drugs that you did not know they were on because they were not getting them under your plan. Also, it's going to give them the ability to meet the 2000 earlier, and now all of their drugs is going to be no charge, whereas you have may have been making calculations based on drugs that was in their history that they were paying because you didn't realize they were on more expensive drugs that could have pushed them through the phases. So the other piece on here that I want to go back to under the drug coverage, which I made a comment earlier, I think CMS did a very good job on this. So the Medicare prescription payment plan is the new for 2025, and it allows the Medicare beneficiary to spread the cost of the medications out across the months in the year and pay that directly to the plan versus at the point of sale. So CMS puts out here, find out what your drug cost might look like with this payment option. When you click it, look what it does. Without this payment option, you'll pay $349 in January. With this payment option, if they sign up during AEP and they are effective 1/1/2025, they're paying $166.67. In February, they go get those two drugs filled for $94 because remember it was $47 per drug per month. This is $349 because it included the $255 deductible. And so now the way the calculations work is anything that they haven't been billed for January plus the new incurred cost for February divided by 11 months left in the year, they pay $25.12. March should go to $34.52. And so you can see what their payments would be, and then at the end they go down to $631. So technically somebody can be getting Mounjaro and Eliquis for $44.97 bucks a month for 11 months out of the year. Actually, 1, 2, 3, 4, 5, 6, 7, 8, 9 months out of the year. But even 1 month, they got it for $25.12. Now, what you got to know is the Medicare prescription payment plan is not a drug savings. Okay, this is not a savings. You can see they're still paying $631 if they were not in the program, $631 if they are. However, instead of having to pay $349 at one time, they can now split all of that out across the 12 months. So I think CMS and Medicare did a very, very good job of breaking this out on the plan finder and being able to show Medicare beneficiaries what they would look like if they opted into this program. This is the program that I posted on my Facebook the other day saying how I had a cancer patient who's on Lobrenna, and the fact that the $2,000 she would hit immediately, she could split that off for 12 months and make it $166.67 each month. That was a game changer for her so that she didn't have to pay that whole $2,000 up front in the beginning. Okay, so that's the part I wanted to show here real quickly. And then what I want to do is I want to go back and I just want to show, I may not have a good example because I may have to use, I'll do another example with Ozempic just so I can show you all somebody that has it covered, but has it covered at like a co-insurance. So you can see what that looks like. Actually, this might work. Okay, so here's this Blue Cross total plan. Let me see if their total value plan is available that doesn't have a premium. So I can have it more apples to apples, but I don't know if Mounjaro is covered on that one. Let me see. Yes. Okay. So here's the Blue Cross total value, 1,466.28. So that tells me that both of my drugs I put in are covered. So let's go under plan details and we go to drug coverage. So when we scroll down here, we see the person is going to pay $639 for Eliquis, $827 for Mounjaro, and the total price is $1,466.28. This is all drug costs because again, this particular plan does not have a premium. And so then you see what the costs are, and then we can go up here and we can see the M3P options again. So they're going to pay more. And here's the reason why. When we scroll down, go to view more drug coverage. This one has a 21% co-insurance on the preferred brand tier. Remember I told you earlier the defined standard benefit is 25%. So that 4% that Blue Cross in this example is paying for the Eliquis and the Mounjaro is going towards the $2,000 out of pocket. So that's why the person is not meeting the entire 2000, they're meeting 1466, is because of the 4% that they're paying for those two drugs on tier 3, from the 21% to the 25%, and also because of this $200 deductible minus the 590, which is the deductible for the defined standard benefit. $390 of that is going towards the 2000 that the member does not have to pay. So I'm going to show you now how we can take both of these. And if I'm going too fast for y'all, it's because literally I'm in my gym clothes. And this just came right after I was talking to somebody this morning, and they're like, "I'm really waiting on your video so you can show me, because I'm a little lost in the sauce." So I just wanted to go ahead and put this out real quickly. I'm gonna have another one with my whiteboard and all that kind of stuff, but right now I just wanted to put something out here so that I can answer those questions, and then I'll slow it down on the next one. No, wait, I hit the wrong button. I need to go to page 1, and then I'm going to add this one. So let's just look at them side by side. So when you look at them side by side, this plane has a $200 deductible. This one has $255. They don't have any premium, so that's $0. And then when we keep scrolling, let's go straight to the drugs, because that's what we're going to focus on. Both of the drugs are covered. Under this plan, it's $1,466. Under this plan, it's $631, and that's because this Blue Cross Total plan has a 21% co-insurance, which is closer to that 25% of a defined standard benefit. This plan over here under United has a $47 copay, which means the difference between the $47 and the 25% of the drug cost is counting towards the member's $2,000 out of pocket. All right, so now let's go back, and I want to show you something real quickly. And I really, really, really wish I would have done this earlier in the year. And I think I've done it for somebody, but I don't think I actually saved it, because it really would have been profound to see the differences of what somebody would have paid in 2024 versus what somebody would have paid in 2025. But the way the plan finder works, now I'm viewing the 2024 plans, but because it's November the 1st, it's only going to show me what the costs are for December. Because if you enroll today, you won't be effective until December 1st. And so right now, it's not as profound as it was, because they're not going to meet. Yeah, this looked much better yesterday. Um, yeah, this is not going to help me, because what happens is the member's not going to meet any of they're not going to go through the phases. Let me see one thing though. No. I'll show you another example here. And I may have to pull it up. Let's use the Lobrenna as an example. Yeah, it may work, because it's expensive. Okay. So and this is 2025 that we're looking at. So as you can see, under this particular Aetna plan right here at $2,000 is what the person's going to pay. There's no monthly premium for this plan. So right out of the gate, it's $2,000. And if we go into plan details and look at what this actual drug is here. So it's $21,787 per month, is what this drug cost. And so that's the retail cost of it. And then the cost after the deductible is what they're putting here. But what happens is, because this person next year, everybody has a 2,000 max out of pocket, it's just the $2,000. So what I want you to see, and that's what's showing right here, January fee will be $2,000. Now, let's go and look at what this person would have been subject to if they had to enroll today for a next month start date. So when we go show 2024 plans, So now we're viewing 2024 plans, and we use this WellCare Assist. Um, do we have the Aetna plan over here? Here's the Aetna plan that we just saw. So let's just do it apples to apples. Just for the month of December, she would have had to pay $3,302 for the particular medication. And so when you go into plan details, and I really wish I would have ran this, I would have kept her. I don't think I did. So you could have seen because it was like $5,200 if she had to do November and December. But here's the drug, and here is the breakdown, which is only going to be 1 month. So $3,302.19, and that's because of a couple of things. One, it's got to go through all 4 phases, and so this particular plan, did they have a deductible? Yeah, so they got a deductible of $300. Now remember, we're in 2024, so she'd had to pay the $300 deductible if she got it filled December the 1st. And then that would, because the drug is $21,000, she was going to go through all 4 phases at one time. The other interesting thing and fun fact for 2025 is the donut hole goes away. So in this particular example, the reason why she's having to pay $3,302 is because she's got the $300 deductible. This claim is automatically going to put her into the donut hole, so she'd have to pay 25% of the cost of Librena, and then it's also going to push her into catastrophic, which plus for 2024, once you get into catastrophic, you pay $0 because of the Inflation Reduction Act. So between the ICL, which is the initial coverage limit, the deductible phase, and coverage gap, her first fill will be $3,302.19. Now, that's just for the month of December, whereas you can see over in 2025, she can get the same medication for $2,000. And actually, in this example, even if I would have ran this in October, it would have been the same because of the price that 21,000 is going to push her through all 4 phases at once. I think when I ran it earlier this week, it was with another plan, and it was also in another county. So for this particular one, 3,302 is what she would have been paying for this year versus the $2,000 that she's going to pay for next year. And also, you can see for this $3,302, the Medicare prescription payment plan does not exist. So therefore, she would have had to pay all this up front before she could actually get her medication. And see how it says down here, when you'll meet your deductible, December. When you'll enter the coverage gap, December. When you'll get out of the coverage gap, December. So this would have been what she would have paid for the entire year of 2024 versus $2,000 what she'll pay in 2025. So hopefully you found this helpful. I see that I got through this in about 18 minutes, so that's pretty quick. And so just hopefully this just gives you an idea of what I'm seeing in the market. And then I'm going to slow all of this down. I'm even going to do my hair and put my makeup and stuff on, maybe even pull out my whiteboard or my smart board and walk through this. But I really just wanted to get this out here right quickly just to be able to answer a question I had earlier this morning. So have a good weekend and drop some comments below and some feedback, and I'll address those in the next video.